Welcome, future orthodontists and dental enthusiasts. Today, we're diving deep into a fundamental concept that dictates the success of tooth movement: frictional and frictionless systems in orthodontics. Understanding how friction works and how to minimize or eliminate it is crucial for efficient and predictable treatment outcomes. This video will break down the complex biomechanics, clinical factors, and practical applications of these systems, drawing insights from comprehensive research in the field. Get ready to unlock the secrets to precise tooth movement. Let's start with the basics of friction. When two objects in contact are forced to move against each other, a resistant force, known as friction, acts opposite to the direction of movement. In orthodontics, this is particularly relevant as arch wires slide through brackets. We encounter two main types of friction: static frictional force and kinetic friction. Static friction is the force that prevents an object from moving when a force is first applied. Think of pushing a heavy book on a table. Initially, it doesn't move. That's static friction at play. The amount of force needed to start the movement is the static frictional force. As you increase the pushing force, the static friction also increases until it reaches a critical point, often called F max. Once your applied force exceeds F max, the object begins to move. Once the object is in motion, the resistance it encounters is called kinetic friction, also known as dynamic friction. Theoretically, kinetic friction is always less than static friction. This means it takes more force to start tooth movement than to keep it moving. This distinction is crucial in orthodontics, as a significant portion of the force applied to a tooth is spent overcoming this initial static frictional resistance between the wire, ligature, and bracket. In the orthodontic context, friction exists whenever the arch wire is in contact with the bracket and ligature, and there's a tendency for movement. For instance, during leveling, as a flexible wire straightens, it slides through adjacent brackets, creating friction between the wire, bracket, and ligature materials. This frictional resistance can be substantial, with approximately 40% to 50% of the force intended for tooth movement being lost to friction. Excessive friction, or binding, can delay or even halt tooth movement altogether. Factors affecting friction. The amount of friction in an orthodontic system is not simple. It's a multifactorial phenomenon, making it clinically unpredictable. Let's break down the key factors. Bracket properties, material. Among orthodontic bracket materials, plastic polycarbonate and ceramic brackets generally exhibit the greatest friction, while stainless steel brackets have the lowest. Some ceramic brackets now incorporate metal slots to reduce this drawback. Width. The effect of bracket width on friction is debated, with some studies claiming narrow brackets cause less friction, and others suggesting wide brackets. Clinically, medium or wide brackets are often preferred, especially in extraction cases. Milled brackets have been found to produce higher friction than cast and sintered brackets, partly due to rougher slot surfaces. Archwire properties, material. Wires like stainless steel and chrome cobalt generally have smoother surfaces and thus lower theoretical friction compared to nickel titanium, NiTi, and beta titanium wires, which have rougher surfaces. However, NiTi's high flexibility can allow it to creep through bracket slots despite its roughness. Size and cross-section. Larger wire sizes and rectangular wires generally cause higher friction than thinner, round wires. Ligature, type and tightness. The method of ligation significantly impacts friction. Arch wires are ligated using elastic modules, wire ligatures, or self-ligating brackets. The tightness of the ligature directly affects the normal force on the wire and thus the amount of friction. Wire ligatures can cause less friction than elastic ones if tied loosely enough to allow sliding, but standardizing tightness is challenging. Self-ligating brackets aim to reduce normal force and allow freer wire movement, though their clinical effectiveness can vary. Force, magnitude, and application. The magnitude and point of application of the force are critical. If the force does not pass through the center of resistance of the tooth, it can cause tipping, which increases friction. Reducing tipping by applying force closer to the center of resistance, for example using power hooks, can help minimize friction. Wire bracket angle, angulation. A higher wire bracket angle leads to greater friction. This is particularly important with pre-adjusted brackets, where excessive tipping can cause binding and anchorage loss. Biologic factors, saliva. The role of saliva as a lubricant is controversial. Some studies suggest it can reduce friction with certain wire types. e.g., titanium and NiTi, while others find its effect insignificant or even increasing friction with SS and chrome cobalt wires. Surrounding tissue resistance. The resistance from surrounding tissues also contributes to the overall frictional forces encountered during tooth movement. Understanding these factors is vital because excessive friction can lead to binding, where the wire resists sliding, and anchorage loss, where unintended tooth movement occurs because the frictional force is so high that the anchorage teeth start to move instead of the target teeth. A more predictable approach. Given the unpredictable and multifactorial nature of frictional systems, researchers developed an alternative, frictionless systems, most notably the segmented arch technique. This approach aims to create a more predictable and controllable force system. In the segmented arch technique, the dental arch is divided into segments, typically an anterior segment, incisors and canines, and a posterior segment, premolars and molars, often stabilized with a transpalatal arch. These segments are treated as two large teeth, each with its own center of resistance. This simplifies the biomechanics, converting complex tooth movements into a more manageable two-body problem. The key difference is how the teeth are moved. In frictional systems, teeth slide along the arch wire like a train on rails. In frictionless systems, teeth are moved with the arch wire, often using loops, analogous to a crane lifting and moving a train car. This eliminates the sliding friction between the bracket and wire. Advantages of frictionless systems. Frictionless systems offer several key advantages. Predictable mechanics. Because friction is eliminated, the force system becomes statically determinate, meaning the forces and moments are measurable and predictable. This allows for precise control over tooth movement. Effective torque control. Loops in the arch wire can effectively increase the moment-to-force ratio, providing excellent torque control of the anterior teeth during space closure. Increased working range. The use of loops and long interbracket distances reduces the wire's stiffness and increases its working range, allowing for the application of light, continuous forces. Selective mechanics. Specific movements such as incisor intrusion or molar uprighting are easier to perform with a segmented arch. Disadvantages of frictionless systems.
Despite their advantages, frictionless systems also have some drawbacks. Increased chair time. Bending intricate loops in the arch wire is a time-consuming process. Patient comfort and hygiene. Loops can be uncomfortable for the patient and may create challenges for maintaining good oral hygiene. Reduced transverse control. Compared to sliding mechanics, controlling the canines in the transverse dimension during distalization can be more difficult. Frictional systems versus frictionless systems. Mechanism. Frictional systems. Teeth slide along arch wire train on rails. Frictionless systems. Teeth moved with loops, crane moving train car. Predictability. Frictional systems. Multifactorial. Unpredictable. Frictionless systems. Statically determined. Predictable. Force loss. Frictional systems. Significant force loss to friction. 40–50%. Frictionless systems. Minimal to no force loss to friction.
Chair time. Frictional systems. Less chair time. Stray wires. Frictionless systems. More chair time. Loop bends. Patient comfort. Frictional systems generally more comfortable. Better hygiene. Frictionless systems can be uncomfortable. Hygiene challenges. Control. Frictional systems. Less control over moments. Anchorage loss risk. Frictionless systems. Precise control over forces and moments. Application. Frictional systems. Most commonly used in daily practice. Frictionless systems used for complex movements. Precise control. Advantages of frictional systems. Despite disadvantages. Despite the challenges with friction, frictional systems remain the most commonly used in daily orthodontic practice due to their ease of application and reduced chair time. Straight wires are simpler to manage, and advancements in flexible NiTi wires have made leveling easier. Patient discomfort and hygiene issues are also less common compared to looped wires. Conclusion. Orthodontic treatment demands controlled tooth movement through precise force application and patience. Both frictional and frictionless systems have their place in clinical orthodontics. While frictional systems are widely used for their simplicity, frictionless mechanics offer superior predictability and control for complex movements. Ultimately, the choice of system depends on the specific clinical situation and the desired biomechanical outcome. A thorough understanding of the principles of friction and biomechanics is paramount for every orthodontist to achieve successful and predictable treatment results. We hope this deep dive into frictional and frictionless systems has clarified these essential orthodontic concepts. If you found this video helpful, please give it a thumbs up, subscribe to our channel for more orthodontic insights, and let us know in the comments what other topics you'd like us to cover. Thanks for watching.